When the information from the Diabetes Prevention Program trial was reanalyzed with regards to the risk of metabolic syndrome, which you recall is a precursor to many of the metabolic diseases we know of, they found that individuals in the lifestyle medicine group reduced their risk nearly 3 times more than the group receiving metformin. When you look at the data even more carefully, it's interesting to look at prevalence. The prevalence numbers are the number of individuals total who suffer from a disease process. And in this case, the number of total individuals with metabolic syndrome increased both in the placebo group and the metformin group, while in the lifestyle intervention it was significantly reduced. Further analyzing this data was this study. It looked at the relationship of age and diabetes incidence in that population. You can see that on the far right, the older the individuals were, the more effective that lifestyle intervention was in reducing their risk. But the older that individuals became, the less effective metformin was. The fourth misconception I wanted to address was that the benefits of lifestyle interventions don't last. I think it would be ideal to try to look at some of the studies we already talked about and look at their follow-up. Here, published in the Lancet, they looked back at the individuals who were part of the Finnish diabetes prevention trial and followed them out here around 8 years. As you recall, that study ended after 2.5 or so years. People who received the lifestyle intervention still have a statistically significant reduction in their risk of type 2 diabetes. Misconception number 5 is that lifestyle interventions are too expensive. In the Annals of Internal Medicine, the study was recently published that looked at the cost of treatment with metformin versus the lifestyle intervention in the Diabetes Prevention Program trial. Their outcomes showed that, quote, compared with the placebo intervention, the cost per quality-adjusted life year was approximately $1,100 for the lifestyle intervention and $31,300 for the metformin intervention. Now, one thing we rarely think about is productivity of an individual. Here they reviewed individuals' healthcare costs who had increased visceral adiposity or belly fat, elevated blood pressure, high cholesterol, etc. They missed 179% more work days, spent 147% more days in bed, and cost the economy $17 billion in lost productivity. Not only do their healthcare costs increase because we're paying more for the medications, but then their productivity cost is dramatically less. The sixth misconception I hear is that lifestyle interventions take too much time. For that reason, creativity is called upon. I like this study from the Archives of Internal Medicine. It was a little 12-month trial with diabetic patients who were largely Hispanic and were under the poverty level. This intervention, they set up computers in the waiting room. The intervention group took a 10-minute assessment. They were asked questions about their lifestyle, their eating habits, these sort of things. And then it printed out a 4- to 5-page report. And it asked them questions. It said, identify 2 or 3 changes that you want to make in what you eat and how you exercise, etc., based on what we now know about you. They then took that in to see their physician for the regular visit. The physician would reinforce the choices they had made. Number of people who were active nearly doubled and reduced their weight by 6 pounds. So a very nice little creative model, especially because most of us know we've spent more than 10 minutes waiting in a physician's office. Misconception number 7 is that lifestyle interventions only work for the wealthy. That last study I just showed you speaks to that, certainly, as 65% of those individuals were below the poverty level. But this next study that was published in Diabetes Care in 2008 similarly disproves that concept. In this, it was just a simple 12-week trial in which individuals in an underserved community of Pittsburgh were invited to join a gathering in a local community center, and there to discuss how to be healthy. At 12 weeks, 46% had lost 5% and 26% had lost 7% of their body weight, which, remember again, directly correlates to the risk of metabolic disease. At 6-month follow-up, more than 70% of them had sustained that. The authors concluded that what will really be fascinating is to follow up long-term and see, hey, did this really work? Did this stick with these people? In perspective, I believe that there is a growing body of evidence in the literature that shows that lifestyle can dramatically impact morbidity and mortality, and that organized lifestyle interventions can be effective, cost-efficient, and really quite sustainable within our communities. Now, very briefly, I want to talk about concerns for why so few physicians are strong advocates for lifestyle medicine. Before I get into that, I want to say that not all is doom and gloom. The numbers are increasing. Some of the individuals that I want to call your attention include Dr. David Katz down at Yale, who does amazing work. Dr. Joel Furman online, fantastic website. Dr. Ripa up in Boston, and along with down in the University of Central Florida. Dr. John McDougall with his outstanding website and getaways for more than 30 some years that he's been running. They're also organized facilities, the like of the Cooper Aerobics Center in Texas, which has multiple branches, the Lifestyle Centers of America, the Ripa Health Institute, and True North Health, a very unique facility with a focus on intensive lifestyle and therapeutic fasting, and the likes of the Pritikin Longevity Institute, along with the Weimer New Start Lifestyle Program out in California. So more and more of these programs are now available to us. And there are community-based programs as well. The one that I'd like to highlight is Dr. Hans Diehl's program, which has been validated in multiple studies and is an outstanding program. Then there are policymakers and health promoters such as Neil Barnard with PCRM, Dean Ornish with PMRI, but there's still challenges. Now I'd like to address a few of them. The first one is that lifestyle medicine is not paid for. My response to this, though, is what are we doing about it? If we believe that lifestyle medicine must be at the heart of meaningful change in our healthcare, we need to fight for that. Second challenge is lifestyle medicine is not a respected field of medical research or practice. When a patient goes to a physician, who will be more respected? The doctor says, John, I'm going to cut you open, put you on the table, put you to sleep, root your arteries, and I'm going to put brand new ones in there, and then I'm going to sew you up, and I'm going to use all this high-tech bypass equipment, etc. That's very impressive. Counter to that, the idea of going to the physician who says, John, if you just eat some steamed green vegetables and brown rice, your heart disease is going to melt away. For us as physicians, we like to feel respected. Telling someone to eat greens and brown rice and walk daily isn't very trendy. Hopefully this will change because we have the American College of Lifestyle Medicine, which is the first academic society promoting lifestyle medicine. Likewise, the Institute of Lifestyle Medicine at Harvard, the University of Central Florida, and the like. More and more academic facilities and programs are springing up. The third challenge really is that in medical school today, we receive insufficient education on lifestyle medicine. The fourth challenge is that the patient adds an extra variable, and they have to perform the treatment. With lifestyle medicine, the patient has to do all the work. But I believe that no one else is better situated to do that job of counseling and education. In studies, it's been shown that a primary care physician is the most trusted health resource. The World Health Organization, again, says something good about this. They say that, quote, all too often healthcare workers fail to seize patient interactions as opportunities to inform patients about health promotion and disease prevention strategies. Challenge number 5, you have to walk the talk. Because a doctor prescribing a healthy diet and exercise must do both. According to recent studies, the Physician Health Study in particular, 44% of male physicians are overweight and 6% obese. This article that reviewed this study in American Family Physician magazine said, quote, patients come to physicians expecting professional advice and a role model to emulate. You would never go to a personal trainer who weighed 300 pounds and got out of breath walking up a flight of stairs. Why would you go to a physician to be healthy if they themselves are not healthy? If we are not caring for ourselves, we're not going to be as effective in moving our patients to effective change. My perspective on this is that there are many misconceptions, and fortunately they're just that, misconceptions. I believe that the evidence for lifestyle interventions is overwhelmingly optimistic. It's a joyful message, a message that we can, but that certainly does not mean that challenges don't exist. I want to ask you, what can we do? The first thing we have to do is lead by example. We have to modify our own lifestyles first, get comfortable with being healthy. But we need to encourage friends and families to do likewise. Because once we're doing that, then we can really reach out. We can educate, we can empower. We can transmit the knowledge of what we have and motivate others. After we do that, at the individual sort of a level, we can really begin to get involved in the community. You know, and I think this needs to transcend the community then and move upward as well, into the political realm. We need to get involved with making policies for the future. Because our nation is at risk facing an epidemic of disease that's fostered by our personal choices. So I believe that lifestyle interventions are the answer. And I believe that we can make the difference. So I encourage you, get out there, get involved, impact your circle of influence. Together we can make a change. Thank you for joining me today. For more information, swing by Restorehealthusa.com. We want to be part of your journey. Let us know how we can help.